Let's talk about Cefixime, a third-generation cephalosporin that's powerful, but needs smart prescribing. In this video, we're diving into the clinical use of Cefixime, both labeled and off-label. We'll explore where this antibiotic truly shines and where it's used with caution due to rising bacterial resistance. Let's start with labeled indications, where Cefixime is officially approved. The first one is uncomplicated urinary tract infections. Cefixime is used to treat uncomplicated urinary tract infections, meaning infections confined to the bladder and urethra, caused by Escherichia coli and Proteus mirabilis. Escherichia coli is the most frequent cause of UTIs, while Proteus mirabilis can also infect the urinary tract and is known for producing an enzyme that breaks down urea, contributing to stone formation. Cefixime is also indicated for otitis media. That's a middle ear infection caused by Haemophilus influenza, Moraxella catarrhalis, and Streptococcus pyogenes. These bacteria inflame the middle ear, leading to pain, fever, and sometimes fluid behind the eardrum. Cefixime helps by inhibiting bacterial cell wall synthesis, essentially causing the bacteria to burst and die. Another labeled use is for pharyngitis, which is an infection of the throat, and tonsillitis, which is an infection of the tonsils, both due to Streptococcus pyogenes, the same bacteria responsible for strep throat. Cefixime helps reduce inflammation and prevent complications like rheumatic fever, a condition where the immune system mistakenly attacks the heart, joints, and other tissues after a throat infection. In patients with chronic bronchitis, which is a long-term inflammation of the airways, often due to smoking, acute exacerbations can occur when bacteria like Streptococcus pneumoniae or Haemophilus influenza infect the lungs. Cefixime helps clear these bacterial flare-ups and restore easier breathing. Cefixime can also treat uncomplicated gonorrhea, an infection caused by Neisseria gonorrhoeae, affecting the cervix in females and the urethra in males. It's effective against both penicillinase-producing and non-penicillinase-producing strains. However, the CDC now advises that Cefixime should only be used as an alternative when ceftriaxone, a more potent cephalosporin, is unavailable. This is because Cefixime has less optimal pharmacokinetics, meaning the way the drug is absorbed, distributed, and maintained in the body is not ideal, and because of increasing bacterial resistance. Now let's look at off-label uses, conditions where Cefixime isn't officially approved by the FDA, but is still supported by clinical studies or expert guidelines. Cefixime can be used to treat enteric fever, also known as typhoid fever, caused by Salmonella typhi and Salmonella paratyphi. It works by eliminating the bacteria responsible for severe fever, abdominal pain, and intestinal symptoms. Though not the first-line choice everywhere, it's sometimes used where fluoroquinolone resistance is high. Sometimes, Cefixime is prescribed as part of expedited partner therapy, which is a public health approach allowing treatment of sexual partners of patients diagnosed with gonorrhea without requiring a medical exam. This helps stop reinfection and restrain transmission in the community. Cefixime can also be used for uncomplicated rectal gonococcal infections, especially when ceftriaxone isn't available. However, careful follow-up and test of cure are recommended to ensure effectiveness. In some cases, Cefixime is used to manage acute bacterial rhinosinusitis, which is infection and inflammation of the sinuses, air-filled spaces around the nose, caused by bacteria like Streptococcus pneumoniae or Haemophilus influenza. It's typically reserved for cases not responding to first-line treatments. Finally, Cefixime may be used for non-typhoidal Salmonella gastroenteritis, a type of foodborne infection leading to diarrhea and abdominal cramps. While most cases resolve without antibiotics, Cefixime can be used for severe or systemic infections. Cefixime is a versatile antibiotic with multiple approved and evidence-based uses, from urinary infections to typhoid fever. But with bacterial resistance on the rise, choosing the right antibiotic is more important than ever. If you found this breakdown helpful, don't forget to like, subscribe, and hit the bell icon for more medical education videos.